Well, I finally made it to the doctor. I'm very excited to get this new COVID-19 vaccine. Hopefully it works, and I can survive the virus if I ever get it. Oh, it looks like I'm next.
Next, please. What's your name, sir?
Yes, my name is Grandpa Jones.
Of course it is. So, what brings you in today?
Well, I was just wondering if I could get the COVID-19 vaccine. I have a lot of pre-existing conditions, including a time where I drank fish tank cleaner, which was a misunderstanding by my wife. And also, my lungs haven't felt the same since I was pepper sprayed by a police officer after celebrating Thanksgiving. Does that let me qualify?
Sir, honestly, I could care less about your stories. We are all out of the COVID-19 vaccine. It looks like the last one was taken by that man over there. Yeah, I just got the vaccine. Let's go party!
But I'm in more danger than him. If he gets the virus, then his chances of living are higher than mine if I get it.
Sorry, sir. I don't make the rules. I just follow them. Okay, who's next? What's going on, everybody? It's Kyle Dockery with the Dockery Docket. We are here with our very 53rd episode of the Dockery Docket. I'm excited to be here, and I hope that you are excited to be here as well. So, this is also the very last episode of 2020, and it is time to talk about something that will hopefully be good for everyone, and it will hopefully be the beginning of the end of the pandemic. Pfizer has released its new COVID-19 vaccine after the media and different blue check marks on Twitter said that this was absolutely not possible at all. A vaccine cannot be created in this short of a time. So here's a montage from MRC TV of all the media personalities saying this was 100% impossible. Take a listen.
And on a vaccine?
We'd love to see if we could do it prior to the end of the year.
But many scientists, including the president's ousted former top vaccine official, say that is overly optimistic.
That's an ambitious timeline, and many health experts aren't so sure it's achievable.
So many experts and doctors today immediately cast doubt on that.
Experts say he'd need a miracle to be right. It would take, over a year.
Experts are warning that kind of timeline may be overly ambitious.
Health experts pushing back.
So many experts.
NBC News did a fact check on this today that a coronavirus vaccine, Trump says it could come out this year. This sort of, happy talk that he's doing about a vaccine.
You cannot talk yourself into a vaccine. The fastest a vaccine has ever been produced from start to finish is 5 years.
Previous vaccines have taken years to develop.
History actually holds a lot of different lessons for us about politicians rushing to science when it comes to vaccines.
Will we get the best vaccine in this timetable, or will we just get a vaccine?
This kind of promise is clearly political, but it's also remarkably dangerous.
Some have even argued it's perhaps dangerous.
So if we say, well, they can't really get this vaccine, the science is questionable. Now we're the negative Nancys. Oh, look at that Acosta, always trying to kill our optimism.
Now, I understand that there is a lot of division when it comes to the COVID-19 vaccine, as many people don't want to take it, and many people are rolling up their sleeves right now, ready to get the vaccination as soon as they can. This episode is not me telling you to go out and get the vaccine, and it is not me telling you to stay away from the vaccine. Both of these decisions are up to you, and I don't want the government to make that for you. You have the right to say no to anything that you don't want injected into your body. However, what this episode is about is the distribution of the COVID-19 vaccine, and who is it that should be getting the vaccine first. So now, of course, the people that should be getting this vaccine first are the politicians, right? Well, according to the politicians, yes, they should. Now, politicians do this to say, hey people, I'm taking the vaccine. That means that it is 100% safe. I'm a government official. You can trust me. And different celebrities in the past did this. When the polio vaccine came out, Elvis Presley had a famous picture of him getting the vaccine, and that was supposed to boost public trust in the drug. If Elvis Presley is taking a vaccination, more than likely you are because you trust Elvis. Elvis wouldn't do something wrong, right? Anyway, the issue with politicians taking the vaccine first is that there are limited resources that we could be using for other people that are trying to battle this virus. According to Jennifer Reach, a sociologist at the University of Colorado State, she said whenever we have a scarce resource, one of the concerns is that distribution will be unfair. She continues by saying, when it starts to look like there's a political favoritism, that can be really damaging to public trust. People don't see these politicians as role models like they saw Elvis back in the 60s or 50s. They see them as privileged people that are leapfrogging over grandma to get the vaccine. Also, yes, this is for both Democrats and Republican politicians. No one is getting off the hook for this. So we have seen prominent government officials like Nancy Pelosi, Marco Rubio, Mike Pence, AOC, who is the youngest member of the House, Mitch McConnell, and even Joe Biden all get this vaccination before people that may seriously need it. And it is being reported that all government officials have an opportunity to get the vaccine. Now, this would be okay if we had a large supply of the vaccine, but we don't, as I already mentioned. And some politicians are standing up to this idea and saying that they won't take the vaccine until the frontline workers or the elderly get the vaccine first. President Trump sort of hinted at this as he wrote on Twitter, people working in the White House should receive the vaccine somewhat later in the program, unless specifically necessary. I have asked that this adjustment be made. I am not scheduled to take the vaccine, but look forward to doing so at the appropriate time. Thank you. So it looks like President Trump will wait, and there are other politicians that are also waiting as well, as Brian Mast of Florida, Ilhan Omar of Minnesota, Tulsi Gabbard of Hawaii, Jefferson Van Drew of New Jersey, Senator Rand Paul of Kentucky, and Nancy Mace of South Carolina. They all made points that they would not take the vaccine before all the frontline workers or senior citizens get the vaccine first. So now this leads us to a very, very important question. Who should get the vaccine first to help both slow the spread and save lives? Well, if we look at the CDC article that looked at race, ethnicity, age, trends in persons who died from COVID-19 from May to August in the United States, the numbers are very interesting and can show us who our top priority should be. Doing the math shows that people from the ages of 1 to 49 make 5.7% of COVID-19 deaths. Then after that, there is a 12.9% increase in total deaths as it jumps from 3.5 in people 40 to 49 to 16.4 from people 50 to 64. Yikes. After this, the death percentages for each group rise until age 80 and over experience a 30.4% of the deaths from COVID-19, leading to the conclusion that older people are dying more from COVID-19 than people that are younger. Of course, there are situations where there are pre-existing conditions, meaning that young people, of course, are not 100% immune to the virus, but the younger you are, the higher chance you are of beating the virus, according to science. This means that the vaccine should go to older people that are living in nursing homes, as nursing homes are right behind hospitals for having the most COVID-19 deaths. Also, people in nursing homes cannot social distance, so it just makes sense to attack the nursing homes with older people in it. So according to this evidence from the CDC, it seems that we need to start vaccinating people 85 and over, and then move our way down and try to vaccinate as many people that are older as possible until a new shipment of the vaccine comes in, and then we can start doing younger people. Does it make sense that the more vulnerable should get the vaccine first? I mean, if there was a house fire that started in the living room and someone was trapped under a piece of debris in the living room, would you run up the stairs and save a person that is free of debris and has no fire around them? Or would you try and save the person that is stuck underneath the debris with the fire right next to them? I hope that you would save the person under the debris, as their life is the one that is most in danger. This should be the case whether they are old or young, black or white, no matter what. If their life is in danger, they should be saved, or at least try to be saved. However, we are dealing with other issues as well, as some people believe that first responders should be the ones that get the COVID-19 vaccine first as well. Now, first responders getting the vaccine makes sense, as if we look at frontline workers, which includes doctors and nurses who have been exposed to the virus since the pandemic started, they need to have immunity to the virus so then they don't spread it to other people in the hospital as they move around. That makes sense, and that is a good logical argument that we can talk about. However, some of the reasons behind why some people are recommending first responders go first is both racist and could lead to more people that are black, white, Hispanic to die. According to Harold Smith, an ethics professor at the University of Pennsylvania, older populations are whiter, and that society is structured in a way that enables them to live longer. Instead of giving additional health benefits to those who already have more of them, we could start to level the playing field a bit. Leveling out the playing field? Is this person seriously saying that we should give the vaccine to a healthy young African American man instead of giving it to an older white man who may have heart disease, diabetes, or other pre-existing conditions just because of the color of their skin? I am no expert when it comes to race, but this to me seems terribly, terribly racist. It seems to me like this person is saying, oh well, let old people die, they're just all white anyway. This is literally coming from the crowd that said if you don't wear a mask, you are killing grandma. Now they are running around saying that they want to kill grandma because she is white. This is wrong and extremely, extremely unethical. Now, I understand the fact that the African American community is struggling with the virus. And when we have enough vaccinations, we should be looking to vaccinate communities that are struggling very, very hard with COVID-19. However, while older populations are whiter, there are still millions of older African Americans that are still at risk of dying of COVID-19 as well. According to Brookings, death rates among black people between 55 to 64 years are higher than for white people ages 65 to 74, and death rates are higher for blacks aged 65 to 74 than for whites aged 75 to 84, and so on. In every age category, black people are dying from COVID at roughly the same rate as white people more than a decade older. So at different ages, African Americans are dying more than white people, especially as the ages increase. So if we as a nation followed this professor of ethics advice and said, old people don't need the vaccine because they're all white, let's give it to young healthy people, the result is more African Americans dying from this virus. The left, in their mission for wokeness and racial equality, are okay with older people dying, and this is 100% not okay. However, sorry to tell you, it just gets worse, as it wasn't just one professor that thought that frontline workers should go first to achieve this wokeness, but there was, according to the Washington Free Beacon, an advisory committee which voted in November to vaccinate essential workers before the elderly, partly on the grounds that elderly skew white, just like the professor said. But wait, it gets worse, as the article continues by saying, the committee openly acknowledged that its intentional plans would result in more deaths than vaccinating older adults first. But the panel said the plan would reduce a racial disparity, something they deemed more important than saving lives. Honestly, when I first read that, I was absolutely stunned. This advisory board is working with the CDC, and they are openly saying that they don't care if people die, they would rather have a woke agenda. I don't care if I get 100 dislikes on this video, or people comment that there's no such thing as reverse racism. This right here is racist. They are basing this on the color of people's skin, and that is 100% wrong. If it was in the other way, and we were saying black people can't get this vaccine and white people should only get it, that would be wrong. That would be racist. That would be terrible. I would be making a whole episode about that, saying that it was wrong and unethical, just like this clearly is. For the sake of the older generation that is struggling with COVID-19, no matter what race they are, I hope that the CDC and this advisory board receive enough backlash that they will change this policy, with the understanding that the people that are most vulnerable should go first. For example, if we look at other vaccines that we have in our world today, we see that the vulnerable go first. With chickenpox, children under 2 are the most at risk, and 90% of all cases occur in younger children, so we give it to them first. Would it make sense if we had a limited supply of a chickenpox vaccine to give it to an older person that doesn't usually get chickenpox that much? No, they would need a shingles vaccine, which is a whole different vaccine, which happens more in older adults. And you wouldn't give the shingles shot to a child because shingles doesn't happen in children. I know that chickenpox and shingles are sort of the same disease, but you wouldn't mix up their vaccines and say, okay, this chickenpox vaccine also works for shingles, because it doesn't. Older people still have to get the shingles vaccine, and young children still have to get the chickenpox vaccine. I really, really hope that that makes sense. If it does make sense to you, please write boo chickenpox in the comments down below. Anyway, back to the task at hand. If we look at the evidence, we look at the data, we look at the science, we can clearly see that older people should go first in getting this vaccination. It is funny to me how during this whole pandemic, the left has told us to listen to the science, over and over and over again. Apparently, they're not taking their own advice, as the World Health Organization, the National Academics of Science, Engineering, and Medicine, and many other countries say that giving the vaccine to frontline workers first is wrong and could lead to more people dying, as I've already said in this video over and over and over again. It is also amazing to me how for all this time the left has been claiming that Donald Trump is 100% responsible for every single COVID-19 death. And then we get an article where an advisory board that is working with the CDC literally said that they know that people will die with this plan of giving it to frontline workers first, but they don't care. All that they care about is this woke agenda. And in the end, this woke agenda will kill us. And we cannot let the left make policy like this. It is destructive and dangerous. Once again, I will say it is okay to say that first responders should go first because they are battling COVID, but saying it is because older people are white is just ridiculous, and something that I'm scared we are going to see more and more in a Biden administration. He may base everything on race or economic status, and in the end, not listen to the science and the data. Then we die woke. The point is that the vaccine should be seen as something that is good, as hopefully this will lead to the end of the pandemic. I have said many times that I wish that this virus would just go away, and that we could go back to our normal lives. There is a possibility that this vaccine and other vaccines that are coming down the pipeline can do that. And because we have a limited supply, we cannot let this opportunity go to waste. This means that we need to have an effective strategy, not based in critical race theory, but in actual science. Who is suffering more? Who is dying more? Where are they dying? And go give them the vaccine. Other people can wait. There is a simple plan of action we can take, and I hope that the CDC is listening. Vaccinate older people, and then essential workers. In return, if this vaccine works, then less people will die and need to go to the hospital, meaning that the healthcare workers will not be overrun with COVID-19 patients. Then, when we get a new shipment of the vaccine, then we can start by doing communities that are highly infected with the virus. Yes, this includes the Black community, Latino community, every single community that we can think of. I believe that one day in the future, everyone will have an opportunity to get the vaccination. However, this is if you want to get the vaccination, and I hope that the government will not force anything on us. However, that may just be another episode for another time. But I just want to thank you so much for listening to this episode of the Dockery Docket. And until next week, like my mom always says, be good, be kind, be loving, goodbye.